So, this interview with Jane Mann, who is also known as the best kept secret in Las Vegas. If you don't know Jane Mann, she is just a brilliant thinker. She thinks outside of the box and she talks all about how our posture, our bite, and flexibility can age us. Stay tuned. As you watch this, you will start to think of aging in a whole new way. Enjoy.
So welcome, Jane. I finally have you on my on my channel. I'm so excited.
Excited. I feel like my background is super boring.
So if you followed my channel at all, everybody knows Jane Mann. She is in Las Vegas. She's known as the best kept secret of Las Vegas. And I'm hoping she's not a secret anymore. I talk about you all the time. Anyway, we've got a few questions for you, and these are questions we get from all over, but Kathy came up with these for me. So she says, you're a rock star esthetician in Las Vegas, and you're a mentor for facial contouring massage, which is your trademarked massage that you came up with. Would you share how you discovered facial contouring massage and how you developed it?
Yeah. Well, golly, I feel like you and I got into microcurrent similar times, right? And I just had a different background coming into microcurrent. I had done quite a bit of marketing, but even in growing up and through college, and then after college, I was certified in yoga. I mean, obviously aerobics, because we were all like in our aerobic, and Pilates. And in Pilates, we were taught to look at the skeletal and the body, the way it draped. So I guess looking back now, that is one of my key influences in doing what I do. I have always looked at the body and then the face, because everything is aligned. And I would do microcurrent, and I spoke for microcurrent companies, and I would be on stage sometimes, and I would have to present these results, and then I couldn't even see the results. And it became almost like the emperor's new clothes. Like, don't you see it? Look, it's here. and I knew there was another way, because I know microcurrent works. And I love what you have done for the industry. And I have loved every single person that comes to see me that watches you has the microcurrent mini. And that is so awesome. Because I am a huge believer that you need a microcurrent unit at home. I'm a huge believer that what I do in the treatment room is very important, but 80% is done at home. And I love that you have done that. So in doing microcurrent, I would look at somebody and I would think, this makes absolutely no sense. Why are we over tightening a muscle that has programmed itself short due to a cervical vertebrae or whiplash or lifestyle issues? This doesn't make sense. And I feel it's not being disrespectful to manufacturers, because everybody has to have a set of rules and regulations, when you sell a unit. But at the same time, there's always going to be a little bit of a fluctuation within that rule. And so I started to massage the muscles. And if you really just looked at the science of microcurrent and the benefit of the current to the muscle, it didn't really make sense that we just had to shorten it. I think that did do an instant result, but it wasn't the long-term effect that we were looking for in the clinic.
Right, exactly. And so you had some dental work done too that was a big piece of your puzzle, right?
That was a huge piece. And, part is, aging. I will, own up that, I'm not 30 anymore. But through it was, my face was changing drastically, and I couldn't quite figure that out. And I realized through working with Dr. Willardson and out of his clinic and that's where you really kind of learn that everything compensates. So if your bite is made smaller, now we've released the obligation or the responsibility of the masseter muscles. And these are the muscles of the jaw. And in the body, so to speak, per kappa or per centimeter, it's one of the strongest muscles we have. And when that muscle is released of its obligation, it isn't that this muscle just stops working. Other muscles have to compensate. And so that really taught me about how the body worked together truly through fascia. So the masseter muscles start to relax. The zygomatics and the temporalis muscles start to take over and pick up the slack that the masseters are no longer doing. And all of this is fascia. We look at and we think, oh, it's these muscles, but fascia controls the muscles. And that's where a lot of times I read, you know, I don't think that this unit works, or I don't like this unit. It's very much a unit.
Nothing to do with any of that. Yeah.
It doesn't. And that's where the ANMA really came in, is I can release the fascia, but if I can't get the client to stop what's creating the muscle response, at least I can get circulation in there and blood flow and help nurture, you know, the skin till they see me again.
Yeah. And the ANMA, it starts to change the face shape on a lot of my clients, because you get 20, 30, 40 years of compacted jaw muscle going on, and you start working fresh blood into that, and it's like, whoa.
It does.
It's really nice. It's
just
I
the
think
lymphatic movement alone is amazing. I had, you know, no idea it would make such a profound change until my clients come back in, and I'm like staring at them. What are you doing? Well, I'm just doing that tool, and I'm like, oh yeah.
Their face shape changes. I've had people's face shape change on the table after doing facial contouring massage. So, you know, I mean, it's amazing how much letting fresh blood and talk about microcirculation and how that is involved in everything.
Well, I mean, microcirculation is basically the life force of our cells. The more research going into fascia is now, and it hasn't been like publicly announced, but in the fascia world, it's considered its own organ.
Yeah, so I saw that.
It has its own, you know, microcircular system. It has cells nestled in it. And so the microcirculation, when we move fascia, even in just kind of moving the tissue over the muscle, we're repositioning cells in such a way that they can divide better. They can, you know, receive
they have more room, right?
Better. Huh?
They have more room.
Exactly.
I was even reading that the connections that move is even faster. Communication is even faster via the fascia than the nervous system.
It is. They say it's faster than the light. So it is this whole system that we've kind of just ignored, only because the fascia, after somebody has died, within 20 minutes, it flattens to see what we had once seen on cadavers. But now that they've seen it alive and working, there's a whole different respect going into this network that houses pain, memories. I read this really neat book, and I don't know if anyone else wants to get it, but it was written by a woman called Mabel Ellsworth Todd, and it's called The Thinking Body. Now, it has nothing to do with microcurrent. It really has nothing to do, it does have some to do with fascia, but this is in the 1930s. And this is when they knew that there was something more than muscle. But she really talked about how, so a policeman will get ready to shoot somebody. So in his mind, he's programmed through muscle memory. I place the weight on the right foot. I adjust my left hip to this way. I will take a breath in this way. And this is all being recorded, not in the muscles, but in the fascia. So it's fascial memory for a golf swing. It's fascial memory for learning to shoot a gun. But it also records fear.
Yeah. It
and
reinforces
so,
it, yeah.
When you and I look at a face, we have been taught, you know, to look at that face, and you do so much with body work. So you probably with body talk, when you touch the person, you already know.
Yeah, a lot of emotions come up already. Yeah.
And fascia tells a story very similar, and that's kind of in teaching in the class is we can know the movements, but how do you read what the story? And as soon as you touch them and you start to realize where the restrictions are, and you watch the way the client talks and you can see they're really maybe overactive on the
Yeah.
right side, and then their right muscle is up and their head is tilted, that's going to tell you right now she's favoring something.
Yeah.
And it might be out of our scope. Maybe we send them to a chiropractor. Maybe we send them to a rolfer. But
Or dentist, or misaligned
Exactly.
bite. Yeah, there's so much more to the way the face lies than just putting a cream on or just doing straight up microcurrent the way they tell us to. One of the things I love, and this is for estheticians, but one of the things I love about your class, and I know you can take the first part online and then do the practical with you, but your class is always evolving. You never sit on your laurels. You're always like, I mean, it feels almost like a completely new class every time I take it, and I learn so much. And I really respect that. I just think it's wonderful. But how do you come up with your new material? Just working on people, or just?
yes, yeah, I love it. And I love it. But it's kind of like I'll notice something and then I pull that thread, and I have no problem calling doctors in Germany or France or anywhere that has more knowledge than me, or I utilize the internet. I'll just say, listen, here's what I'm teaching. This is my hypothesis on it. There's no real concrete evidence. So much of this is anecdotal.
Yeah.
You know, I see it.
You're like the center of this wheel and the spoke, and you just go out and just grab info from all these different places to work on this theory. It's really cool. I love that about you. You're just not afraid to ask anybody anything.
No, I'm not. And I love, even when I was speaking with a really good friend, I said, what do dentists think of fascia? And he goes, we don't know anything about it. He goes, that's why we want you to start talking about it with us.
Yeah.
And so now, whereas I have always gone to dentistry versus plastic surgery as far as structure and balance of the face, now they're even starting to take into consideration, could it be a fascia issue versus this is just a muscle issue? And it's just exciting. And I think, thank you. Every class is always different. With what I'm trying to do is now I'm doing interviews kind of like you with fascia experts and trying to keep the girls that have taken the class currently with kind of the pace where I am. So it's just fun.
So tell us about what happens when people get plastic surgery and they get the cutting of the fascia, and then tell us some of the things that you've seen.
Okay, well.
In Vegas, I know you've seen a lot.
This is interesting. And it kind of goes with, sometimes I feel like it's the world according to Jane. So as I am saying this to anyone watching this is my experience. And I usually hold back quite a bit. So what I'm saying has been somewhat vetted through professionals. I think plastic surgery is amazing. I mean, who doesn't want to look 30 years younger like that? But there is a responsibility in doing that. When clients are sent to me after a facelift, if they go to, a lot of people will go to California, they're sent, and the first thing that we do is the fascial contouring, but in such a way that it is lymphatic. Because when you get a facelift, there are certain times they will create scar tissue because they want the face to heal a certain way.
Oh, yeah.
That makes sense?
Mm-hmm.
So they may, if it's a deep facelift, they may completely lift up in here, and there may be a certain amount of scar tissue they want to form to hold that tissue up. So they sometimes suture, the malar fat pad up and do different things. And that's why you look amazing for a certain amount of time. But if you aren't working the fascia and you didn't do the pre-work, I am a big believer in the hidden three, and I'm very boisterous about it. Posture, bite, and flexibility. You can't have one without the other. Mm-hmm. You have to know that your bite is proper, and 87% of Americans have a bite that they've either ground down or it's imbalanced.
Yeah.
So this imbalance, again, the body has to compensate because it's going to do everything to protect you. And so everything will kind of shift. And then we see sometimes a real asymmetry in the face that we're looking at. And you'll start to notice kind of a hint is one trap will be higher than the other. The face actually is like a smaller portion, and the other side that where the teeth meet first has the stability and kind of is the structure of the face. And as this side slowly collapses, they start to see the jowls falling. And then the next thing you know, they're rushing to a plastic surgeon. And I say it's like correcting on an incorrect foundation. So now we've got the posture that is compensated for the kind of instability. And next goes flexibility. Because when the posture goes, discomfort and pain set in. And when discomfort and pain set in, people aren't as willing to go and do exercise because they want to compensate and work with the body to dance around the pain.
Right.
And in this, now they become inflexible. And flexibility is exactly what we were talking about earlier, your microcirculation. And so now we have stopped kind of being flexible. We're not using our shoulders because there's discomfort maybe in the armpits. The arms are super tight and you see carpal tunnel syndrome. The backs are hunched over and their necks hurt.
Yeah.
And the next thing they're doing is they're going in to get surgery that's creating more, restriction of blood flow and scar tissue. And they blame it on the doctor. And this isn't a doctor issue. This is, you didn't do your homework ahead of time. That's where I really try to say, listen, if my clients come in, the first thing they're like, what can you do about this? I said, well, let's just cut to the chase. What do you want to do? Well, I don't know. What do you mean? And I'm like, are you going to go get a facelift? Because if you are, then our aging plan is going to be geared to get you the best results with the facelift. If you're like, no, I want to age gracefully, great. You can't start at 49 if you want to look good at 50. We're going to have to do this a little bit differently.
Yeah. So you're it's what do you say? Posture, bite, and what? What was the third?
Flexibility.
Flexibility.
3.
Yeah. But the Anma you created to help with this bite issue and to help with some of the posture and flexibility, the microcirculation. Can you show us how to release the jaw with the Anma?
Yeah.
Oh, it's a green one.
This is always fun. And I know you have been so patient with me as I have molded through the various, but you've got your fingers here. And I call these the thumbs. I call this kind of the arch of the back.
Huh.
And I call this kind of the arch of the neck. And I'll explain why. And then you have the spine. Every single piece does something. So we know that the fingers go really great on just the basic tissue. And the basic tissue is when you touch the skin, it moves so freely on top of the muscle. So we're not moving muscle. We're moving kind of that superficial fascia, just kind of right on there. And that's the way that you're doing here. We're not even going deep. We're just moving that tissue on top. The fascia starts from the top of the skin, the stratum corneum, all the way down, interweaving even through the cells. So that's what's
yeah. Oh yeah, I've seen that. Almost like the marbling of fat, right? It's almost.
Yep. But it goes through the cells.
It's like a 3D spider web almost. That's the way I like to think of it.
It's like a hexagon of sorts.
Yeah.
So even just
on the spider web.
gently on here, it's making you do that.
Hold on. Hey, tell me what it's made out of, because I know that you're not doing just straight up plastic. I know that you put a lot of love into the. Did you switch? Okay.
It is BPA free plastic, but as you saw with the clear, the hemp model, I really wanted to be so in line with what worked. And when I tried more natural resources, they broke easier. And there was, each one of these is hand poured. And so that's kind of what's neat. Like you can see this one got kicked out for quality control because it has like
a little niche. Yeah.
I
thought they were hand poured. That's so cool.
It is. Each one is hand poured and it's our mold. There are tons. I have fake ones here. Let me find. Here's a fake one. So you can see the fingers are shorter. The thumbs
Yeah.
are different. The handle
Yeah.
is smaller. So when we tried the hemp, that was a nightmare because there was no way we could control the discoloration because of the natural product. It also
Oh, yeah.
bubbled quite a bit.
Oh.
The viscosity of
Yeah.
the unit wasn't there. But each of these, they're hand poured. So sometimes you may notice there's a slight change in all the color. Sometimes they're a deeper green, sometimes they're lighter. It's human error. It's not like a big robot making these. It also makes that they're not seamed. This isn't put together by two pieces.
Right.
This is, anyway, so back to this.
I feel
We go here, and that's like great. It's a great pressure for the scalp, which I think so many times we forget. I sit in the car and I just do this on my scalp all day long. The fingers are great if you have, I like the windshield movement. This hits this muscle, the corrugator, the procerus. This is a great one.
I just took off my eyebrow.
And then I love the arch of the back underneath here.
Oh.
But if you have more tissue, you can go upside down like this and go out.
Oh, so it gets all that deeper length.
Now
Love
you can
it.
also do that underneath the neck here.
Oh, cool. I love it.
So that's the kind of like with the thumbs, each of these, the acupressure points in here.
I love this.
The sides of the eyes, but it was really intended for, there's the digestion point and there's a point right under here. And this, while it does stimulate digestion, it also releases a lot of that built up tension in the zygomatic. So just pressing this, and if it's painful, then typically it's aggravated and needs to be stimulated.
I'm working the different side. Okay.
One of the spots that is really nice is just around here because the scalenes are here. Another part people sometimes forget are here.
Yeah. Yeah, I do this on all my clients where I'll release this first and like, oh, that feels so good. Like, you didn't know you had all the tension there, did you?
No.
Especially the clients that do spinning or Peloton, they're just like bricks right here.
Yeah.
Faces are dragging.
It pulls it down. And that's kind of a funny thing because when you start even, and I love how you kind of show this, and I did a video on YouTube the other day where I was saying if you have the Claire Blend Mini, pull with one hand and stick that mini in there just to get some circulation in there.
Yeah, that's a great idea.
And then also what you can have them do is, I don't have a mini here, but let's just say that this was kind of the mini, you can kind of, I would pull up and I would anchor and pull up. With the
to work. Yeah, this whole area.
Yeah.
Oh, that's interesting. Which way but the pros would be side by side like this? Just
I don't know. I've never figured out how I liked working with mini like that.
I mean, in the long
term, cross hatching, and it's really just getting the current in the face. The people that when I tell them, about that is I just say go up. You can never go wrong up and out.
Just go up. Yes.
Don't get too technical. Just
do.
Do it. A lot more efficient than thinking too much about it. And that's one of the neatest things about that unit.
Yeah, it's simple, easy to travel with, if we could ever travel.
Right? Trying to think of other uses people send me, because a lot of times they'll send like little things. Oh, did you know? And one is pregnant women's feet. Yeah.
The
The men will do the anma on the pregnant women's feet, even during labor, because
Really?
it
I love it.
releases just a lot of the swelling. And so you can do it just real gently on the feet. And then for carpal tunnel, and I constantly am in my office with
Ooh,
between
good.
clients, and I just do the arthritis.
God, that feels good.
Right? It's hard not to just do that.
I never even thought about using on my fingers like this, but yeah, I get the. So we've talked about the ANMA, we used it a little bit. Another thing that you have been working with this year, I'm gonna let you talk about it a little bit, but we will be having another interview dedicated solely to this, but tell us a little bit about it.
Well, it is, you've probably sat, you know, in the classes where I'd say, I'm going to create a beauty bite, because I think that we've always been so focused on what we want to see as a result, we don't go back to root cause. And again, if you look at the body, the teeth height balances on the C1. And as your teeth start to wear down, which a majority of people as they get older, it just does, now your head is going to come forward a little bit, because all of a sudden the distribution of the weight of the head just comes forward. And this starts to create an aging cascade physically with the body. There is a really unique, simple appliance that can be fit in the mouth by the client at home and monitored either through you and through you kind of your groups, or it can be monitored through the company, that will restore the engagement of the masseter muscles. And it does this through an element of stretch. And I don't know, do you stretch? Do you do yoga or anything like that?
Once in a while.
Once in a
I
while?
do it a little bit each day, but not, I don't sit down for a purposeful hour. I should.
Session, something. Well, weird stretch is always good because it creates tension on the bone. And that's why they say as we get older, we need to either do some kind of weightlifting to create muscle tension on a bone, or stretch to create a muscle tension on the bone. And what this does is it releases an osteocyte, which is a bone cell. And this is how we can eliminate osteoporosis and various conditions that you get when you're older. The same thing happens in the face. Your mandible can remodel or reabsorb bone. It's contingent upon the stress placed on it with the muscle. And so if we create a stretch in the muscle, and a great practice is just opening your mouth with your lips closed.
Mm-hmm.
You're
Yeah.
creating a real gentle stretch. And
Right.
and this appliance helps kind of guide this process. And it seems silly because I do have clients that will say, well, can I just do this? Yeah, you
No.
can do it.
Well, yeah.
But I have to have a little reminder in there not to shut my mouth. But over time, just as I was talking before, the muscles are either going to program themselves short, long, or indifferent. It's all in the fascia, it relates to the central nervous system, and then the body adapts it as its new norm. So what we're doing is we are kind of reprogramming the muscles to go to its natural anatomical state. And when this happens, it's like a natural Botox. And this orthotic can last for as long as you take care of it.
Yeah.
So I'm really excited. I do believe it's a game changer. I personally have used it since July, and I feel like my skin,
Good. Your skin looks good.
my face looks good. Like it just looks, I don't know. But you know, we're so critical of ourselves. Everybody is critical.
But you don't have filler. You people always ask me. I'm like, no, those are her cheeks.
No, I had such sympathy for you, and you were upset about, you know, people can say the meanest things. And people will get on my videos and go, oh, it's easy. You have filler, you have this and that. And I'm just like, listen, I'm just helping you out. Like, if you don't like me, just subscribe to me.
I know you and I are probably two of the most natural estheticians that we know, that don't do all this other stuff to our face. But yeah, it's funny. It's funny.
No, I don't. And I really feel good about that. And I think all of my North Star issues, I think we have this way of looking at our face at what we don't like. And so now I don't gravitate to that. To me, it was always the built up muscle. And I had no idea, again, that this built up muscle was because of the change in my bite and how I was wearing down, that everything built up. And this whole time I was blaming it on cheekbones, but it wasn't, it was muscle. And the moment I redistributed the tension of my bite, that redistributed the muscle kind of building and relaxing.
Yeah. So I know you're coming out with a book, and I want to hear more about it.
This has been a baby of mine, golly, for 3 or 4 years. And every time I think I've finished it, I come up with something. And so right now I'm a publisher, and it's going through what's called a developmental edit. And the publisher is Balboa Press. And I chose them because they do kind of more well-being. And I felt that this is a book on beauty, but yet I don't talk about it. I talk about the influence of what beauty is, more or less. And I have 4 influencers that are inside of us. And one is the bold. And the bold is just a woman. All of these are based off of my clientele and clients of estheticians that I've met. The bold is a woman that is a doer. And I think the most classic impression of her is you feel her, you don't see her. You feel her walk into a room. She could just come in ripped up Levi's, a hair completely short, but it'll be platinum blonde, or it'll be natural gray. And she will have wrinkles, and she'll have glycation, and she doesn't care, because her personality consumes you and you're entranced by her. You adore her. She's a doer. She's probably in Syria or Turkey or Italy right now volunteering. And looks are the last thing to her. And so she defines herself through who she is. And then you have the perfectionist. And we all have a little perfectionist in us. And I think every esthetician has a perfectionist, because she helps us hone in and be very, very specific. But the detriment is when she hones in at herself in a 5-time magnifying mirror and starts like comparing the lines, and if her lips are uneven, because this eventually leads her to a plastic surgeon or a filler, and there's a tendency to be overdone. And then you have the forgotten. And the forgotten is typically, again, a lot of us who are young mothers, everything is going to our children. Everything is going to the PTA. And we've overbooked, we've overextended, we've overaccelerated. And again, she's a part of our personality we have to make friends with and understand. She's gotten us through. For me, I was a forgotten being a single mom with 3 kids. And I didn't know how to start placing boundaries that I could say no, because I was so scared for so long. How am I going to make this go further? And then we have the strategist, and she just does things right. She stood in the right line when it came to a pause button and balance and confidence. And, she just somehow manages these personas and really gets that this too shall pass. And so if she has lines, she's okay with that. Or maybe her daughter's getting married, so she will get Botox. She's never going to be too extreme in any direction. And so it takes you through the course. And so the book's name, I think we've settled on, is How to Age Like a Strategist. And it goes through how our brain, the dopamine injection from getting treatments done, And then it talks about the hidden three, which I think are very important. And then really the value of a skin therapist or a skin coach, whether it's online or it is in your hometown. But it's easy to get impulsive and start reaching over here and reaching over here. So you have a following of women. And the reason they look so good, especially the ones that have come see me, because they have followed your guidelines. You're not like over here and then over there and mixing up. You've created, probably without even knowing it, Christine, a really uniform, good plan with well-chosen products that don't overly strip. And so you are teaching these girls to age like a strategist without even knowing it. And so this book is just really kind of along that route. It goes into hidden rapid aging influencers on diet, what glycation is, what essential fatty acid does, what eating disorders do, or gastro bypass, just things that I think that are so reachable in this impulsive world. People don't realize that there is a downside to the impulsivity. So it's really just kind of meant as an aging guide that any clinician can use or somebody could purchase and kind of assist along their plan.
Well, I read an earlier version. I don't know if it's way better now, but I love the original. So I'm excited for everybody to read it, because really, we all fall into these at one time or another where, well, I don't know if I've ever been bold, but
I think
I don't know if I've ever forgotten my face.
You
not my personality, but I do forget, like, to take care of my body and that kind of stuff. So yeah, the forgotten is in all of us, you know.
Yeah.
We live in an accelerated world. But the version I read, I loved, and I can't wait for it to come out. So you'll have to let us know.
Now it's in their hands, and there's certain things, but I think it'll be fun. It's not, like I said, it was more of one of my list of things I wanted to do, and it came from the heart. So I think more than anything, that's what's always kind of like one of those things. You do it and you don't know why necessarily. You just hope that people find as much enjoyment out of this I had writing it.
Yeah. Nothing better than work that comes from the heart. Well, thank you so much, Jane. I appreciate all your time, and stay safe, stay well. And do you have any parting words for us?
Just thanks for having me on.
You'll be back, right?
Always come back. It's fun.
People are constantly asking me, "We want Jane. We want Jane."
Okay.
Hey, when is your next class? Oh, I guess it's not for a while, but do you have any on the schedule for later this year?
Yes, I know there's Hickory in May, Hickory, North Carolina, end of May. Irvine in, I think it's October. You can go online to byjanemann.com under classes, and you can see them there. The online course, I've kind of created two. One is included with the live class, and that is nice because there's constant updating on what fascia is. So I'm always bringing out the new information. So people that have taken my class live before always get new content. And then there is just a basics, and it's just the raw class, the videos. They can start practicing because it's not for everybody. Somebody may just want to just invest the small amount and go, I don't want to do it. It's not for everybody.
I love it. It changed my whole practice. So I hope that for everybody, but yeah, you're right. It's not for everybody. It's very, but you know, even if I've seen you do a 15-minute treatment and change somebody's face completely, which is bizarre. Because I'm like, I want to do every little last thing. But even doing a quickie with it is so effective.
Well, you know, when you're doing it and then your hand just goes wherever, there's a name, and I've got to get it, but that is the true release. When you get to that point that you can, and your hand will go maybe over an eye and go over here, that type of adjustment stays. I mean, fascia can reorganize, and nothing will change your practice in microcurrent faster than at least having some knowledge of how to reduce it. Because I don't go out on a limb to say you will not ever raise those marionette lines if there's a spasm there. and you're trying to do microcurrent alone. It's just like, you know, trying to punch something into place. You have to finesse the body. You have to let the body relax and let go. And what is exciting, and I know that we're even doing now the whole mid face inside, where I don't, you know, once you learn it on the outside, but really going in and stretching that fascia.
It's so important. I've had clients move out of state and then come see me and say, nobody, I mean, I've done a whole series and nobody does my mouth area. It never looks as good as when you do it. Because we know how to release it.
Yeah. Well, and you teach your client too how to release it. I think I brought it up, but the fascia holds memory. And one way when you get a release that's really tough and you're in tune enough is to say, there might be a memory that's so random that you were like, why am I thinking of this now? And what does this have to do with anything?
Yeah.
Acknowledge it and let it pass. And the moment the client acknowledges it, it's like the fascia can acknowledge it and let it go.
Yeah.
And that's just, I think, some of the nicest thing. I had a woman get up and she's deaf. And afterwards, she talks well, but she just said, it must be amazing to change people's lives. She's like, you have helped me so much in like happiness. She goes, I don't even care what my face looks like. It's like my world just changes every treatment that I do with you. And I think that that's one thing about the facial contouring, that I think we're doing so much more than we really know at this time. And one day we'll know.
Absolutely.
More.
Well, thank you so much for your time, Jane. And this is to be continued.
I look forward to it.
All right. Thanks a lot.
Okay. I'll talk to you. Bye.